Welcome to Redo Lifeg 74 Mind Quilt. If you find this content helpful, please do not forget to subscribe, like, share, and comment. Here are some questions that will test your knowledge. It is a good way to see how much you know and what you may need to go back and review. There will be a 15-second pause between the questions and answers to give you time to think about the correct answer. Let's begin. A patient with schizophrenia approaches the nurse very agitated and says, "The voices are telling me to hurt my roommate." What should the nurse do first in this situation? A. Tell the patient firmly that the voices aren't real and that they need to ignore them. B. Ensure safety by instituting one-on-one observation and removing any objects that could be used to harm self or others. C. Calmly distract the patient by guiding them to a quiet activity in the day room. D. Leave the patient alone for a few minutes to see if they relax, while you quickly notify security. Take a few seconds to figure out the correct answer. The correct answer is B. You want to ensure safety at all times with one-on-one supervision and remove potential weapons. Why is this true? When a patient is experiencing command hallucinations to harm someone or themselves, safety is the top priority for everyone, and this includes the patient. Option A, rejecting or contradicting the hallucinations, could increase the patient's agitation. Option C might be helpful for benign, non-threatening hallucinations, but not for command hallucinations. Option D is not correct because you would never leave a patient who is threatening harm to themselves or others alone for safety reasons. Here is a select all that apply question. A nurse is teaching students about the normal aging changes in older adults. Which of the following findings are considered normal age-related changes? A. Presbyopia, which is difficulty focusing on close objects or farsightedness. B. Presbycusis, which is a decline in the ability to hear high-frequency sounds. C. Mild short-term memory lapses, such as forgetting a word or misplacing items. D. Significant confusion and disorientation in familiar environments. You have 15 seconds to select all that apply. Okay, let's see how you did. The correct answers are A, B, and C. D is not normal. Here are the rationales. Option A, presbyopia, loss of near-focusing ability, is a common normal aging change. Most people over 40 experience difficulty reading fine print as the lens loses elasticity. Option B, presbycusis, age-related hearing loss, is also expected, especially loss of high-pitched tones. Option C, mild short-term memory impairment, such as slower recall of names or where one placed their keys, can be a normal part of aging. Option D is not a normal age-related change. Significant confusion, disorientation, or dementia symptoms should always be investigated. While slower cognition is normal, an older person should remain alert and oriented. Okay, how did you do? Let's continue. All right, here's another one. An 80-year-old client manages multiple chronic conditions and takes 8 different medications prescribed by 3 different doctors. Which nursing intervention is most important to help prevent adverse effects of polypharmacy? A. Advise the client to take all medications in the morning to avoid forgetting doses later in the day. B. Ensure all healthcare providers are aware of all medications the client is taking and encourage regular medication reviews. C. Arrange for a nurse to visit daily to sort and administer the client's medications. D. Tell the client to stop taking any medications that cause mild side effects. You have 15 seconds to see if you can figure out the correct answer. All right. If you guessed A, you are incorrect. The correct answer is B. Let's discuss the rationales. A is incorrect because not all medications are meant to be taken in the morning. Some are spaced out or taken with meals or at bedtime. B is correct because it addresses the need for an accurate, updated medication list that should be shared with all of the client's providers and pharmacists. C is not correct because it is typically not feasible for a nurse to make daily visits unless the provider deems this necessary. It also does not solve the matter of polypharmacy. Finally, D is not correct because the client should never adjust or stop medications without consulting the prescriber. Indiscriminately stopping meds could cause harm. Before we continue, thank you to those of you who have watched these videos and find them helpful. Please write a comment and let me know what you find helpful or would like more of. Also, if you want more challenging questions, head over to redulafeg74.com and check out the 60-question digital download nursing challenge course. It is interactive, can be downloaded and used on any device with or without a network connection. Other videos will follow and will be available at a discount to anyone who purchased the previous video. All right, let's continue. Here is our last question. Are you ready? All right. A nurse is caring for a patient who has a nasogastric NG tube attached to continuous suction after surgery. Which acid-base imbalance is this patient most at risk of developing? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. You have 15 seconds to come up with the right answer. Okay, the last question. Do you know the answer? The correct answer is B, metabolic alkalosis. Here are the rationales. Continuous nasogastric suction removes acidic gastric content rich in hydrochloric acid. The loss of stomach acid causes the body to become more alkalotic. Metabolic alkalosis commonly results from loss of gastric acid due to vomiting or NG suctioning. The patient may have signs of lethargy, twitching, and cramping of the muscles, or dysrhythmias due to electrolyte shifts. A would be more from bicarbonate loss from something like diarrhea or acid retention from kidney failure. Respiratory acidosis or alkalosis, options C and D involve changes in CO2, carbon dioxide, due to hyper or hypoventilation, not NG suction. You made it! Great job! Please do not forget to like and subscribe. I will see you soon.